This is Cameron Keys, DPT 14, performing the Integumentary Case Study 5 for the lymphedema patient. This wound appears to be in stage 3 lymphedema. It has thickening of the skin and skin folds. There's marked skin deterioration. It has an elephantiasis-like appearance. There is dry skin, hyperkeratosis looking appearance. There appears to be lymph fluid that is constantly leaking from the wound. The circumference of this limb, we can't see it in comparison to the contralateral limb. But it's likely to be at least 30% larger in appearance should it be a unilateral wound, and that would also help classify this as a stage 3 lymphedema patient. This patient is, according to the case description, in secondary lymphedema, and my hypothesis for that is that this patient's decreased heart function from the right-sided heart failure has caused a higher lymphatic duct volume, a higher load on the lymphatic ducts due to the heart's inability to get rid of the lymph fluid as quickly as it should be able to. And that's caused all of this swelling and later edema with the comorbidity there with the right-sided heart failure. And this is consistent with the typical etiology and mechanism for lymphedema, that being that the lymphatic ducts are they're disrupted, that there's an issue in the lymphatic system causing more lymph accumulation than normal, and that usually results in the extremities being affected, and here we can see that clearly. This patient appears to be in a chronic state of lymphedema with this wound, and my reasoning for that is that he has been dealing with lymphedema for 5 years in the left lower extremity. It appears also to be a result of his heart failure, which would end up in a state like this, where he would chronically be dealing with the swelling and edema if it hasn't been dealt with. The main barriers that I'd anticipate with healing for this patient would be patient compliance and adherence to the protocols we provide, that likely being multi-layer compression, bandaging, manual lymphatic drainage that we'd provide for them and give them tools to do on their own if they have help at home or elsewhere, and then exercise. And I anticipate that the exercise might be the biggest hurdle for this patient, due to their activity levels that are likely low due to the heart failure. And I would anticipate that if we can get this patient moving as much as possible, that they'd have the best possible prognosis. And so the barriers there would be just patient compliance with the program. The plan of care for this patient would depend on whether or not we can perform an ankle brachial index. And if that ankle brachial index is normal, we would start with compression. But if the ankle brachial index was abnormal, which would be 0.5 to 0.7 or less than 0.5, that would result in us consulting with the patient's physician, or possibly referring to the surgeon should it be less than 0.5, just to ensure there's no surgical procedure that would be required. But Should the ankle brachial index be normal, we could go ahead and start treating this conservatively. Patient education for this patient regarding their wound would be making sure that they understand that exercise in any form, even just moving in proper instruction of exercise, such as sit to stands or 6-minute walks or moving around their home, are important, and I would stress that with this patient in helping them understand that this can be improved. It may take time, but the more motion that is possible is essential for that recovery. I would also stress that adherence to the plan that we provide, that being compression, manual drainage techniques, and that exercise and motion is essential as well. And that would be what I would instruct them in for education. One last thing that I thought of that might be good to educate this patient with as well is that lymphedema, especially stage 3 lymphedema, is not something that these treatments are likely to cure, but we can reduce the symptoms that they're experiencing and the pain that they're having. So it may also be important to emphasize that with the patient. For goals, 2 goals that I've thought of that might be suitable for this patient would be to improve by 50% on their score for the lymphedema, Lymphedema Life Assessment, Lymphedema Life Impact Scale. I think that would be a major improvement to make in 6 weeks, a 50% increase on that score. Another goal would be to reduce the circumference of their wound, and the statistic for that, I think, is probably very varied depending on the patient, but maybe a 10% decrease in circumference in comparison to their non-impaired side within 6 weeks, 6 to 8 weeks. I don't have a lot of experience in that, but I think that might be an appropriate goal, at least a template for a good goal. The numbers there, I'm using my best educated guess.